A quick note regarding the treatment of choice for APAC, that is acute primary angle closure, or ACG, acute congestive glaucoma. Now, after initially aborting the attack using pilocarpine eye drops, what do we do as a definitive management for the patient? We're going to do a laser peripheral iridotomy. Now, what is this laser peripheral iridotomy? It is a small opening on the periphery of the iris. So the pupil is in the center. We're going to make a small opening in the periphery. Now, how is this going to help? Now, imagine a compound with a big gate. We all have a big gate. Now, what happens if this big gate is locked? We do not have access into the premises, right? But we all have a jugaad. What do we have? In all our houses with big gates, we have a small gate within that big gate, or a separate small gate. So we have access into and out. So the same way, the small peripheral iridotomy is going to help, even if there is a relative pupillary block that can happen in these kind of patients with risk factors. You can have an extra opening through which the aqueous from the posterior chamber can come into the anterior chamber and keep the anterior chamber deep and the angle open, so the aqueous keeps flowing. This treatment of choice, do we only stop with doing in this affected eye? No, we also do it prophylactically in the other eye or the fellow eye, because there is definitely going to be the risk factor, that is probably a hypermetropic eye which has a narrow angle and a shallow AC in the fellow eye too. So we need to do this laser peripheral iridotomy, that is using Nd:YAG laser in both the affected eye and also prophylactically in the other eye in the same sitting probably. So that is the treatment of choice, where you do laser PI in both the eyes for APAC or ACG. Now, ma'am, why not trabeculoplasty like what is given the option in the quiz today? Trabeculoplasty, what does it do? Next video.